Hello, my name is Christina Corwin. This is my physical assessment video for health assessment class for fall 2021, SUNY Downstate, class 1222. And this is my physical assessment video, and we'll go ahead and get started. Hello, I'm Chrissy.
Hi.
I'm going to be your RN today.
Hi.
And I'm going to be doing a physical assessment, and we're just going to get some data, and then you'll be able to see the physician after that. Okay? I'm going to make sure that we have privacy by closing the door or the curtain, and this is the part where I'll also wash my hands or use hand sanitizer. Okay. So we always start with explaining privacy and then washing hands. Also, make sure the patient is in a comfortable position. Are you comfortable right now?
Very much so.
Okay. If they were in a bed, we might change the height of the head of bed and stuff like that. Okay, good. So I'm just going to be asking you some questions. Some of them might be a little bit weird, so just go ahead and answer them, and we'll go on from there. Also, part of the assessment, I'm going to be using my stethoscope to listen to some of your body, and I'm also going to be using my hands to touch your skin, just to check for pain and stuff. Is that okay?
Yes.
Okay, I'm going to explain what's going on throughout the procedures. If you have any questions at any time, please feel free to ask. And if something makes you uncomfortable or you're not willing to do something, just please let me know.
Absolutely.
Okay? And all right, so just first off, go ahead and tell me your name and date of birth, please.
My name is Miles. My birthday is January 7th, 1979.
Okay. And I want you, without looking, just tell me your best guess as what the day of the week is and the date.
It is Saturday, December 11th.
Great.
2021. Yes.
Cool. Awesome. Okay. And I'd also like to ask you, just tell me the name of the clinic that we're at right now. You can just make something up.
That would make
Chrissy's Clinic.
Christy's Clinic.
Okay, great.
There you go.
All right, and now just go ahead and tell me a little bit about why you came in here today.
I came in here today because I've been experiencing some abdominal pain, which is abnormal for me, and I haven't seen a doctor in a long time. So it seems like a good time to come in.
Okay, great. And then can you tell me, do you have any allergies?
No.
Okay. Drugs or substances?
Nope.
Okay. And go ahead and just tell me any medications you take and why you take them, please.
I take Abilify for depression.
Okay.
That's the only one I'm on.
How is that for you? Do you tolerate it well?
Yeah.
Okay.
So far.
Great. And finally, this is the time where I would be asking some questions about health history. In the interest of time, we're not going to do that now, but I'd be asking family history of relevant diseases, stuff like that. Things, smoking habits, things like that would be asked at this time. So at this time, we're going to go ahead and take vitals. We're not going to actually take vitals in the interest of time, so I'd be doing blood pressure. I'd be taking a pulse ox. We can actually do that one. I'd be taking temperature. Let's get our pulse ox here. Good. And then I'm going to find the radial pulse. And I'm assessing the radial pulse for strength and rhythm, but also this is the time when I'm counting respirations. And I'm going to count respirations for 30 seconds and also note the strength and rhythm of the radial pulse. Okay. So now that we've collected vital signs, the last vital sign I'm going to ask about is, are you having any pain right now?
No.
Okay. No pain or discomfort anywhere?
At the moment, no.
Okay, great. Oops. All right, at this time, we're going to do some physical examination. I'm going to be examining your eyes and your head and neck. Like I said, if you have any questions or needs throughout the process, just let me know, okay? All right, first thing I'm going to do, I'm actually just first going to palpate the sinuses. Do you have any pressure or discomfort there?
No.
Great. So going to palpate head. Any discomfort when I do that?
Nope.
Great. Okay, and go ahead and open your jaw. Close it. Any pain?
Nope.
Okay, awesome. All right, this time I'm also going to check pupillary reaction. So go ahead and look at the painting back there. Okay, and pupillary reaction is normal. I'm also going to go ahead and tilt your head back, please. I'm going to just look at the nasal mucosa. Please open your mouth. You can say ah if you want to, but you don't have to. I'm checking condition of oral mucosa and dentition. And I'm going to also go ahead and palpate on your neck. Is that okay?
Mm-hmm.
I'm feeling for lymph nodes being swollen, and then I'm going to palpate both carotid pulses, one at a time so as not to cut off blood to the brain. So I'm assessing both carotid pulses for rhythm and strength. Okay, good. All right, now the two things to remember is ongoing throughout this whole thing. I'm doing my mental status check throughout the assessment, and I'm also always checking condition of skin. All right, so at this time, I'm now going to do the upper arms. I'm not going to do a complete upper arm assessment with range of motion, but I'm just going to be looking at skin, looking for edema, redness, changes in hair growth patterns, and then I'm also going to, at this time, palpate both brachial pulses for strength and rhythm. And I'm going to do it on the other side. Good. And at this time, I'd also go ahead and just do a quick capillary refill test. And it fills up right away. That's good. Bilaterally. Awesome. Okay. And something I should recommend to you is don't forget to see the dentist every 6 months and get your vision checked every year if you're able to do that.
Right.
I'm going to be doing an assessment of your cardiovascular system now.
Okay.
So the first thing I'm going to listen to is your heart. Do you mind removing your shirt for this? Thank you. Cool, thank you. All right. First thing I am going to be, now I'd be assessing the skin too here for edema or any lesions, anything out of the ordinary. So first thing I'm going to listen for is the aortic valve, just right lateral to the sternal notch. Okay, and then I'm going to listen to the pulmonary valve, which is left lateral to the sternal notch. I'm going to go down to the tricuspid valve, about 2 or 3 ribs down. Listen there. And I'm going to finally go to the point of maximal impulse between ribs 4 and 5 to listen to the PMI for the mitral valve. And I'm going to listen there for 1 minute. And I'm listening for S1 and S2. And if there's any other sounds like S3 or S4. Okay, I listened for 1 minute there. All right, now I'm going to go ahead and be listening to your lungs, okay? So each time I put the stethoscope, just take a breath in and a breath out, okay? So I'm going to start above the clavicle. Take a breath. Move across. And now I'm moving down in a ladder shape. Good. And I do this about 6 times on the front. Great. And then I'm going to move to the back and do the same thing. And I started about C7, right between the scapula, and move down 9 spaces in the same ladder formation, comparing the sounds I hear, if I hear any adventitious sounds on either side. So in the interest of time, we'll have listened to 9 spaces on the back in a ladder pattern like that, and also getting on the sides there. Okay, finally we're going to end the assessment with an abdominal assessment. Okay, so I'd like you to lie down, please. Sure. You want to have the patient lying down for the abdominal assessment or somewhat supine. And then you also want to make sure you listen before you palpate so you don't affect the peristalsis artificially. So I'm going to listen to the right lower quadrant. And immediately I hear bowel sounds. And I'm going to auscultate here for 1 minute. And since I hear good bowel sounds in that quadrant, I'm not going to need to listen to all 4. But I will at this time go ahead and palpate all 4 quadrants. You have any tenderness or pain there?
No.
I'm going to palpate all 4 quadrants for tenderness and pain.
No.
And then finally, can you show me where you were having abdominal pain?
Kind of sharp in the center.
A sharp pain in the center?
Yeah.
Okay. And when did that start?
About a month ago.
Okay. And how often does it happen?
Like maybe once every 2 weeks.
Does anything make it better?
Lying down.
Okay. And what would you rate the pain at its worst?
At its worst, like maybe a 3, just a concerning pain.
Okay.
Yeah.
At this time, I also want to recommend to you a few things about your body systems. I have to remind you to eat a diet with good fiber. Remember to get your flu shots to just keep your cardiovascular system in good working order, and try not to smoke. Do you have any questions?
Nope.
Okay. Normally, an assessment would continue on with the lower extremities, but that will be all for ours today. Thank you.